Good afternoon, everyone. Welcome back to Tuesday's session. I think we can already start the meeting. So I see that people are still joining. So I'll put on the recording. Hi, everyone. Welcome back. So welcome back to the meeting, which is held by VODAN Africa and Asia. Today we are going to discuss a number of things. I have put the agenda in the chat box. So as usually, we are going to start today from the update on the health facility communication by Putu. So Putu, please take the floor.
Okay, thanks, Alia. So I will update our discussion yesterday with the country coordinator. The first update is from dashboard communication topic list progress. So from Kenya, William still communicating with Camry for the dashboard. It is with set, and William will go to Camry for the dashboard communication topic list. And there is a suggestion from Dr. Reginald. Dr. Reginald suggests that we should discuss with the director of Camry before do the implementation to explain the implementation to the director of Camry. And from Uganda, Mariam still communicating with KIU for the dashboard communication topic list, but expected will finish the dashboard topic list answer this week, and she will send the answer to me this week. And for IBBUL from Nigeria, I didn't have any update because Dr. Ibrahim still in the same meeting, so he cannot update. And also Abdullahi wasn't in the meeting yesterday. From Solidar Med, Gerjan was there, and Gerjan update that he will continue the communication with Dr. Manhibi, and I already put Dr. Manhibi in the list of VODAN webinar email list, and they will discuss about the contribution in the implementation, especially in the for the mock-up from there on the site. And from Somalia, I discussed with Din Jamal because last week or 2 weeks ago, Din Jamal request to set up a meeting with Ministry of Health, because Din Jamal told me that Ministry of Health want to know the technical part of VODAN Africa project. So I told Din Jamal to set up the meeting, and we will discuss the schedule later. Alia, I will invite Alia, Mariam, Rudwan to attend the meeting, so we can discuss with, so we can explain the technical part for the Ministry of Health in Somalia. And for the general overview of the health facilities report, now I'm finished with Uganda and Kenya. Kenya is only for Camry health facilities, and right now I give the draft to Mariam and William to check the health facilities, and maybe after Mariam and William check the comment from me, so I will send Uganda and Kenya health facilities overview to Professor Miriam to check it once again, so we can finalize the report. So that's all from me, Alia. And also, sorry, one more things. And on Thursday, Dr. Reginald and I will discuss with NMS, and we will explain about the interoperability part of the project. So that's all, Alia. Back to you.
Thank you very much for these updates, Putu. Very much appreciated. So the next point on agenda is the update on templates and vocabularies. Basically, the main update on that one is that later this week or next, at the beginning of the next week, we're going to have a meeting with John regarding the vocabularies. So it's going to be the final review of the vocabularies that has been that have been created in VODAN. This is the main update on it. I don't have any more issues regarding the templates and vocabularies, so I'll pass the floor to Ulras on the CEDAR deployment update. So Ulras, please take the floor.
Thank you, Aliyah and Putu. Hello, everyone. Yes, regarding to CEDAR deployment part, as we having some issues on it, as we have some different versions of virtual image. Last week we did some troubleshooting on it. Then at the end it was just the problem with a virtual image. So I believe this week we will have new one from VODAN, because the person who provided this virtual image, yeah. So we are just trying to communicate and solve this problem, solve this issue. I hope this week we will solve it. Yeah, that's all from my side.
Thank you very much, Ulras. So for these updates, next on agenda is update on the dashboards. So Yelin or Oluwole, please, can you update us on that one? Yelin?
Alia, Yelin cannot join the meeting because
He's on the call.
he have a call. He's on the call?
Yeah. All right. So he's not responding, so probably he...
Hi, Aliyah. Yeah, I think that's the dashboard lead at the moment is with Oluwole, but he was there yesterday when we had the meeting. But he's waiting now, I think, for the work to be done at your end on the tests of the queries and the completion of the inventory by Putu on the data points to be included for both the dashboards within the facility and the one across. So that is the update of that.
Okay, great. So regarding the queries, so basically they have been theoretically checked. So on the CEDAR Stanford, so as I mentioned yesterday, so basically it now works, and the queries that have been written on Jupyter Notebook are in place. That so basically as it was initially discussed, we have received the results. So I think probably from that side we can say okay. Yeah.
I think then the next step that could be considered is that if you have a number of test queries that Oluwole can then see how he can pipeline those into a dashboard, which could be assumed to be at this point a local dashboard first, and then later one across.
Yeah.
So that the front end is now supported by a pipeline into the back end.
Yeah, clear. Okay.
Is that something that you can pick up with Oluwole then?
So I think for that we firstly need deploy the CEDAR local version and then test the query from the localized versions.
Not necessarily. Sorry to interrupt. Not necessarily, because for the dashboard to be finalized front and back end, it does not really matter whether that is done as a prototype first on the CEDAR queries and then can be transposed to the in-clinic locally deployed version later.
I think we need to check how we can connect the query itself, because it was written in Python, and as I know, I'm not sure what language is using Oluwole, so we need to check that how we can incorporate both like the tools so that they really can respond.
Correct. Yeah, I think that maybe needs to be put on the agenda for the next Monday meeting.
Okay. Yeah.
I'm sure that Oluwole using JavaScript, because he
Yes.
last time
Yeah.
he showed the
He's
request.
using Java. Yeah.
But the logic is the same. I think there's.
Yeah. So I think the point would now be to extend the pilot in CEDAR Stanford with a backend to the dashboard in CEDAR Stanford. And then as you go on with the pilots within health facility and then later across, then Oluwole can move as an extension to the successful queries.
Yeah. Okay. So I think the point is clear. So I'll contact with Oluwole regarding this one and see how we can incorporate both sides. Okay, so the next point is on agenda is update component input into THIS by Nurullah. So Nurullah, can you please briefly update us on that?
Nurullah is not on the call, so I'll give an update on this. So the current situation is that the algorithm works. It basically takes all the metadata that's been created on a given templates and then sends it to the DHIS2 demo system. There was a concern, security concern and authorization limitation, which was clarified yesterday. Okay, it was made a bit more clear that it would actually not be of any, there would not be any security concerns, as this would basically be done locally within the facility. So the next step for us is to basically arrange a meeting with the DHIS2 handler at KU and Kenya, and basically discuss the current situation of the DHIS2 instance being used at KU, and also figure out what the requirements would be and then come up with a plan. Yeah, that's the update on my side. Thanks.
Thank you very much, Mariam, for this update. So I think we can move to the next point then, update on the backup procedure by Herjan.
Yes, good afternoon. Last week there was a discussion with Solidamed. They have committed to also try to do an installation here in Zimbabwe, and on that we can then also test out the backup procedure that was written. I think it was discussed that we need to have a meeting with all of us to discuss what needs to be backed up. I'm not sure how to facilitate that, but that can be done. The discussion document is available, so whenever you think that the discussion has to take place, I'm ready for it.
Okay, yeah, good. Sorry, I was like overwhelming with my problem that I just, if you give me some time that I could finish my thing and put in a road, so I will come back to you, and then we will discuss about the backup for sure. Yes, it is like very busy time for me. Like I hope within 2 or 3 days I will solve it, and then yeah, we can discuss.
No worries. I've put the email address also for Dr. Haman Hibi in your message board. So yeah, we can set up the meeting and go and see how to put the tests up.
Okay.
Thank you.
Yeah, thank you.
Thank you very much, Ercan and Olras.
Aliyah?
Yeah.
The next point is the coordinators meeting, which will go to Dr. Reginald. But before you go to that agenda point, I would like to take the floor to welcome Dr. Waziri Bala and to ask Dr. Ibrahim from IBU to introduce Dr. Waziri Bala to us. Very welcome, sir. Dr. Ibrahim, perhaps you would like to take the floor.
Thank you so much, Prof. Miriam, and thank you all, everybody. Good afternoon from Nigeria. We have on this call Dr. Bazir and Dr. Waziri Bala, a very highly respected professional in the medical services of Nigeria, particularly in Niger State. He has studied so wide into the PhD level, assigned being a medical expert. He has been an advisor to VODAN Nigerian team. As one of our templates, we give him on the leadership and guidance of Dr. Raji, which we're all familiar with. So Dr. Waziri Bala has just been appointed the Chief Medical Director of IBB Specialist Hospital, which is part of the list that we have among the health facilities of Nigeria. So I hereby introduce Dr. Bala Waziri to also give his words. Thank you so much, Prof.
Thank you very, very much, Dr. Ibrahim. And Dr. Waziri, congratulations, first of all. And the floor is yours, sir. Welcome.
Okay, dear all, thank you so much for inviting me to be part of this great meeting. I'm glad I'm pleased to be part of you. I've been following the trend and I'm quite excited about the initiative of VODAN. And we look forward to a very good and good collaborative effort that will lead to quite impactful research output. It's quite a great initiative. I remember even yesterday I was discussing with Dr. Ibrahim about that. Even currently we're already on electronic medical record. Most of our things are like captured on electronically, which is not obtainable in most public institutions, but as it is now, we are already on electronic record, which will make it easy to capture data that actually require. And actually, my center was actually one of the leading centers that actually actively participated in the management of active cases of COVID-19. So I'm pleased to be part of you.
That is very wonderful. And I must say congratulations. The Nigeria team is serving us so very well in this project together of all the country teams. And it's a pleasure to have you here. Let me hand over to Dr. Reginald, who is the coordinator of the country coordinators, to also welcome you, sir. Dr. Reginald.
Yes. Yeah. Thank you very much. Welcome, Dr. Wazir. I really like your name because it's a Swahili name that means somebody of importance. So you're bringing great value to VODAN Africa, and we're very happy to be working with you. I'm going to share very briefly what the coordinators do. Every week they meet and share in detail what is happening within VODAN Africa, especially as we are moving towards the deployment process. Thank you very much and welcome, Dr. Wazir.
Thank you so much. It's a pleasure.
So Aliyah, allow me to share my screen, please.
Yes, Dr. Reginald, you can share it already.
Okay. Okay. So country coordinators meet every week. And last week we met on 20th. And on 20th, this was the agenda. preparedness towards CEDAR localization. And then question from Tunisia about bulk data and Excel sheet production, displaying official letters on VODAN website. And present were Professor Miriam Van Dreysen, who is the international advisor to VODAN Africa, Professor Francisca Oladipo, who is the coordinator and also a member of the board of VODAN Africa, Dr. Regina Nalugala from Kenya, Dr. Mariam Gadalou from Tunisia, Dr. Bernard Chazo Bachi from Zimbabwe, Dr. Ibrahim Abdullahi from Nigeria, Dr. Sakinat from Nigeria, Kecham Van Stam from Zimbabwe, Mariam Basaja, Uganda, Dr. Jamal from Somalia, and Obina, our able communication officer. So I just say this for the sake of Wazir because he's joining us for the first time. And so in the working on agenda number 1, these were the updates. Professor Francisca reported on the successful installation of CEDAR localization and testing by Nabombi, and we found that it was working very well. Efforts were underway for the continental query between Africa and Europe and acquisition of the domain name for VODAN portal. So that means VODAN Africa version of Onto portal and VODAN.health. After successful CEDAR deployment, the same exercise and testing should be performed in each pilot hospital in respective countries. The deployment in each country would assist in identifying unforeseen challenges privy to each country. Some countries may not have electricity, some use generator, some the internet is under restriction. So we need to be clear that the system works. All systems should work well before embarking on required training. On agenda number 2 and 3, for Tunisia, I think has also been discussed now about bulk data and Excel sheet production. So Dr. Mariam was to check with Aliyah, and then it will require a copy test CEDAR template by Stanford and parallel the same with the work done by Aliyah. On the official support letters, we agree that some of the letters should not be displayed unless authorized by respective government ministries. So the letter of support from Ethiopia was removed from the VODAN website upon the request by Ethiopian team. The current political situation is a bit sensitive for that kind of information. And that was our report. Thank you very much.
And Aliyah, maybe I can add on to that we had a successful meeting last week with Dr. Kudakwashi Madzeke from Solidamet, and that he accepted to also enter into the team from Zimbabwe. Perhaps I should introduce Ronald Manhibi, who will be the technical lead from Zimbabwe, and I could ask Getjan to do that. I think that he should also be invited to participate in the Tuesday or Monday meetings, Aliyah. But let me ask Getjan to speak to this.
Yes, greetings. Solidamet is an NGO that works already over 70 years in Zimbabwe and is supporting several health facilities in Bikita, Zaka, and Chiretsi districts. And set up in 2016 a digital health section next to the HIV, NCDs, mother and child, and oral health sections. That unit is being led by Dr. Manhibi, who is a computer scientist, studied in South Africa and Zimbabwe, and he has built virtual machines and a whole portfolio of digital health solutions that are now being integrated into the structure of the Ministry of Health. So yes, when he is invited, he will participate in the meetings. Solidamet has committed to also build as soon as there is the architecture is complete, to build up a mock virtual setup also in Zimbabwe to do the experiments, and he is also committed to help in the backup procedures. I think that's Dr. Manhibi, Ronald, and I hope he will be present next time.
So from our side, do we need to still do something? I could imagine perhaps Dr. Reginald that it is useful to invite Dr. Madzeke here in the Tuesday meeting, just like we have invited Dr. Waziri. And I also think that Hejan, who is expected to participate in the country coordinators meeting, Dr. Madzeke or Dr. Manhibi?
I would think Dr. Manhibi. He has also a very good relationship with the Ministry of Health for integration of services. Actually, on Saturday, we had a meeting on the Impilo network and also discussed VODAN activities. So I think it will be Dr. Manhibi for practical activities.
Okay, then maybe Dr. Reginald, it's good to invite both of them to the country coordinators meeting of tomorrow, and maybe also to this Tuesday meeting, and then they can decide where they want to fit. I think Dr. Madzeke would just really only come for the acquaintances and to get to know the team. Otherwise, then I think Dr. Manhibi will follow up things for all practical matters.
Yes. So Manhibi is also Kudakwashi?
No, Manhibi is Ronald.
All right, Manhibi is
and
Ronald.
Madzeke is also Kudakwashi. I think we are deploying numerous Mariams and Kudakwashis in this project. That is true.
Okay.
That's right.
All right. Thank you, Dr. Reginald. Back over to you, Alia.
Thank you very much. So let's move to the next point on agenda. So I see that the next point is special issue updates. So Professor Miriam, is Misha going to update on that one? Because I see he's not on the call, or are you going to briefly update us on that one?
Yeah, I also don't see him on the call. And I also have to say that I don't have an update, unfortunately. So all that I know from my end is that I think everything has been sent out, but I could maybe ask here how it has been received and if there are any questions or comments by the authors on the comments received. Mariam has asked for a little bit more time because also she has many articles, to consider the comments and also to write her rebuttal on the comments, as is usually done when you have when your articles are being reviewed. So maybe we can ask here whether there are any questions in relation to the comments now received. Maybe Mariam can begin and say how this is working for her, and then I see Inau, Dr. Reginald, our first authors. There are quite a few people here who are first authors. So Jelien, maybe I can hear Putu, yourself, Alia, Dr. Van Stam, Eric, Flickenshield. So I'd like to hear what the thinking is and how much time you need. Mariam.
Mariam?
The line is breaking.
Yeah. We can hear you.
Maybe
well,
otherwise, yeah.
I'm hoping to be done by currently. Yeah, can you hear me?
Yeah, you were dropping, so you can start again.
Okay. So I was basically saying that in regards to the time, I hope to be done by this Friday. If I'm basically targeting this Friday, but latest Monday, latest.
Okay,
Yeah.
that is very good. Yeah,
Yeah.
and congratulations on the the comments received, Mariam. Dr. Mariam, you also received your article.
Hi, Professor. Hi, everyone. Yes, I received the comments and I'm working on it. I will try to finish with it by Friday also.
Okay, that's excellent. And Dr. Mariam, also, maybe this is for announcement after this agenda item, but I think we have an announcement in relation to Zora and would also like to thank her. So maybe after this we can bring that up.
Thank you so much, Prof.
Yeah. Any of the other authors? What about you, Putu?
Yeah. Hi, Prof. Yeah, I'm finished all of the article and I sent back to Misha. Actually, there are 2 articles. There are like many comments on the article, but I'm finished with that. I think last week I'm finished with all of the articles.
Okay, so no problem with the comments.
No problem with the comments.
All right. Okay. And Alia?
So basically, I also finalized it and sent back to Misha. So yeah, that's right.
Excellent. Great. Dr. Reginald?
Yes, the article with Esther was already submitted. The comments were incorporated and submitted to Misha.
But you have not received a review. Is that so? Because it was a delayed article. So have you not received a review?
Unless, let me, Esther, or maybe Esther could comment on that, because what we saw was that it was like it was final.
Inau, do you know anything about did you receive the review? We can't hear you, Inau. Reginald, maybe this is the thing to check. And yes, then we better make sure that that is in order, because that's the only article where there could be a question mark.
Yeah, because there were comments and then we looked at the comments and incorporated them.
Yeah, but did you receive the 2 reviews from the reviewers?
Yes.
Oh, okay, then you're good. And you have sent it?
Yes.
Okay, good. Okay, then Dr. Getjan?
I'm involved in 3 articles, which one needed substantial work, which we have done, and I think you saw. The other 2 articles did not come to me, I think. So I asked Misha, and I've seen one of the replies to one of those 2 articles, and that was fine. The second one I haven't seen.
Oh, I'll have to check then.
Yeah.
So I will do that. And the one that you substantially reviewed, is that ready for final submission?
I think you saw that work. So, you know, that was the review of the article from Zimbabwe. And the other 2, yeah, they are, well, the one that we substantially overhauled, I think, you are aware of, I think. And so for me, that's finished.
The status of it is that it's, if I review it, it can be sent on to the peer reviewers.
Yes, it
right?
can. Yes.
All
yes.
right. Okay. Then I will do that. Thanks. Thanks. This is actually useful, Alia. Eric.
Oh, yes, I didn't receive any reviews, but I was not the first author, so I do together with Putu the articles.
Okay, so that one is the one on the access and control. So that
Yes.
has been sent back. Okay,
yeah.
That's good. Thanks, Eric. Then Yelene. I can't hear Yelene. And anyone else? I think that all the others are not first authors. Maybe Dr. Ibrahim, are you first author on one of the articles on the capacity building?
No, Prof. I think I'm not on that article, but we can work on one. We keep planning, we keep cooking without eating the meal.
Thank you. There are 2 articles with quite a relevant Nigeria team. So one went back to, I think, Dr. Francesca, the other one, I'm not sure, Dr. Sakinato. So maybe if you can ask what the status is of those 2 articles, that would be really helpful.
Okay, Prof, another suggestion, Dr. Waziri Bala and his team, they were leading on a publication on COVID primary investigations. So maybe after my discussion with him, we can look at the paper and send it back to you for further advice. And if it's possible, if the templates will permit, maybe they'll have a better place to publish it because they have done a lot of work on it.
Please do. Yes. If you send it to me, then I will look at it, of course, and I'll respond very quickly this week.
Thank you so much, Prof.
Okay, so then I'm expecting that most of this plus the overview article will all be available by next week. So then we are starting to get into publication by sending it to Feng Hong. So it will be special issue volume 4, but I think I'd said that last week already. That's all from my side, Alia. And then, well, maybe one thing to say is that we then should start with another special issue in which really we can document all of the work that we have done since, because this was really all the work done up to the start of this new phase in February. So all of the work that we have done since February, I think should be subject to a next special issue. But let's first get this one ready. All right, thank you, Alia.
Thank you very much, Professor Miriam. So the next point is on agenda is question and answer. So let me check if there is anything to discuss or raise from your side.
Well, definitely from me, because Dr. Miriam has an announcement in relation to Zora. First of all, Miriam, do you want to speak?
Thank you, Prof. Yes. Unfortunately, I have to say that Zohra can't continue in this project because she has some health problems. So I'm looking for another person to replace her in this profile, and I hope that I can find the good person rapidly. So but I'm asking if there is problems with the agreement, because we are in the middle of the period. So if there is some issues, I want to know it to solve this problem if it can cause any problems for yes.
Well, first of all, really sorry to hear that. And I think it will be nice, Obina, if we can send a letter of thanks or an email thanks and also best luck for the future to Zora, and thank her really for all the work that she has done. And Dr. Miriam, maybe we can discuss offline together with Frederick the other question.
Okay, thank you, Prof.
I have a question.
Yes, hi, Inau.
Hi, sorry, my microphone wasn't working, so I had to figure out.
So you can update us on that article at the same time.
Yes, it's actually about the article. So I got 2 reviews. I sent back the first one, the one that delayed, and then I got another review from, I think the reviewers from the journal, and both of them were very conflicting. One was with minor suggestions, and one was very major suggestions. My concern is that the reviewer raised a point about relatedness. So basically saying that we are not investigating the fair equivalency, we are instead investigating the relatedness of the concepts to fair. So she basically suggested we should put it as FE instead of we should put it as FR instead of FE, which I adopted because I thought, she did make strong points. That's the first thing. And then the second thing is about the second reviewer. I kind of didn't really work on her points because I thought that they're kind of, how to say in a nice way. I didn't understand her and she didn't understand the article. So I kind of just ignored that. The third thing is Professor Wright, and I think maybe you should, just a suggestion, maybe you should ask Misha, or maybe I should forward you what I sent to Misha, because there are a few things that you suggested that were not really in line with the data intelligence journal, the template or something of this sort. I checked it out and it was not really in line. So yeah, maybe just go through it one more time and let me know what you think.
So, okay, thanks, Inau, that's good. Yeah, I think there were a few articles where the reviews were, very different, which can happen, that is completely fine. But I haven't seen the reviews that you received. However, I don't think that any of the other articles on fair equivalency received the comments about the terminology, and they're the same reviewers. Mariam, right? You did the first article on fair equivalency, but did you receive any comment on the term equivalency?
Yes, I received comments for both articles actually.
No, but on the term equivalency, because Inau is saying that they didn't agree. It was something like relational or something.
Oh, yes, they had a suggestion, basically to call it, sorry, just a moment, I'm just,
okay, who's he?
So the command was to basically edit out, to change a few things in the article, and one of the things was the title, and one suggestion was to change it to fair related terms. So I'm still in a dilemma actually. I wanted to talk to you about that. But I was thinking that would stay the same. And there were a few other suggestions as well in regards to the pillars, the go change, and to basically change that to go negotiate. So there were quite a few comments that some I might actually reject, but with reason, of course. For example, the one on the article about the facilities, the information flow of health data within the facilities. So one of the reviewers basically suggested to change that to clinics, and yet to change the health facilities to clinics. But then the fact that there's a teaching hospital as well, it's not really a clinic. So those were some of the main comments that I received for the two articles.
Okay, so on the articles of fair equivalency, it's really important that the semantics remain the same across all of the 6 articles on fair equivalency. I mean, this is really something for advanced English native speakers, but I don't really see a problem with the term fair equivalency, but maybe I'm too close to that. but it's too detailed to discuss here, but we have quite a number of people who have done the articles on fair equivalency. So I'm glad that you brought it up, Inau. Mariam, shall we discuss those comments and then send an email to all of the first authors on fair equivalency articles and take decisions on the rebuttals?
Yes, I think that sounds great. Yeah.
Inau, does that help you?
Yes, and while you do, please check out the reviewer's comments and why she thinks it should be related as opposed to equivalent. She does have some good points.
Yeah, what is your sense on that one?
I put it as relatedness because of the points that she raised.
Yeah, and then so then the idea is that the policy items are related to and not the same, but equivalent is also not exactly the same. Equivalent is something is equivalent to, then it is similar to in my reading, but it's not necessarily also related. Depends a little bit on exactly the language that are related to the fair facets, the 15 fair facets. So in your sense, you felt they were more related than equivalent. That was your reading, Inau.
Yeah, because equal is like, equivalent is like from equal. So kind of, they're equal, they're the same. I don't know. I'm not a native speaker either, but.
Hey, you're Kenyan. That's pretty native. Just kidding. Yeah, I don't know. Dr. Ibrahim, did you have a fair equivalency paper? No, I think.
Prof. Miriam, can
yes.
I comment on that?
Yeah.
Yeah, this is thanks for emerge this issue because I ignore this issue because I will ask Mariam about this, but I forgot to ask Mariam about this. But I'm not native speaker also, but in my opinion, to my view, because I use fair equivalency in my thesis, so I prefer use equivalency because for example, like I compare satu data and satu data principle and also fair principle. The principle is equal, interoperable in satu data. It is same with the interoperable in fair. So I prefer to use term of equivalent rather than related. What is that? The other term relation or related term, because if I say that interoperability in fair is related with satu data Indonesia, I think it is not a good term to describe the connection between these two principles. So that's my opinion, Prof. Miriam.
Yeah, I think that, I mean, why the term equivalency was chosen in the first place was that it was really intended as a measure for having a policy environment which would be adequately supportive of and in line with fair principles. So that is where I feel fair equivalency relates better to that purpose than fair relatedness. What I see here is equal in area of volume, but not superposable, like insignification or import. So it's not the same, but it is, it's going in the same shape or same form.
I think another point is
no.
It largely depends on your understanding of the task as you are doing the task. So for me, and I think I can speak for the VODAN Kenya team that was involved in this task, we were not only looking for the word interoperability exactly, but we were also looking for words that may depict interoperability. For example, the machines need to understand each other.
Yeah.
Sorry, that was a call coming in. The machines need to understand each other. But what if the machines, what if it's written, the machines need to be able to work together to produce a result? So, and then they say, it's not directly interoperability, but there is something that points to interoperability. So you see that we counted.
Yeah.
So it is related, but it's not directly interoperability.
In one of the definitions is corresponding or virtually identical, especially in effect or function. So the object of the facet would need to be in a relevant way represented in how you scored that.
Yeah.
Because otherwise, why would you be scoring it? Because where is the beginning and the end of relatedness?
Good point.
Yeah, I think that it needs to be equivalent. And that if it is too much away from the point of that fair facets, then it is questionable whether it should be counted.
Okay. So did you say you and Miriam Bassaja are going to have a meeting after this to clearly decide?
Yeah, we will have a meeting to go through the comments that are relevant for all the fair equivalency articles. I'm glad that this came out because I had not realized it. So I'm really happy that you brought it up, Inau. And then we'll send a message to all of the authors. And we have heard what Putu said, what different people said. So then we'll be taking that into account. Okay, is that fine?
All right. I have to leave. I'm going for my next meeting. Have a good time, guys.
This time, yeah. Let me just quickly ask Obina to announce the letters that have been sent, the thank you letters, Obina, and then I'll hand back to Aliyah because we have to close. Obina.
Okay. Good evening, Professor Miriam. Can you hear me?
Yes.
Okay, good evening, everyone. So we've sent letters of appreciation to Dr. Tobert Nyeswa, I think Johns Hopkins University. I didn't know whether I pronounced the name properly. Then to Mount Kilimanjaro, to Kemri, to Lady University Medical Center. I think we sent it to Dr. Pancrase and also Hide Oinstein. Then we also sent to Nelson Mandela University. And I think I've talked about Mount Kilimanjaro and Kemri, Kenya. Then also to Somalia Ministry of Health, to Uganda Ministry of Health. I think Uganda Ministry of Health has responded, and Mount Kilimanjaro Medical Center have responded. Okay, due to the political situation in Ethiopia, we didn't send to any letter of appreciation to our Ethiopian colleagues. So thank you, Professor Miriam.
Thank you, Obina. Excellent. Aliyah, back over to you.
Thank you very much, Professor Miriam and Abina, for the updates. So with that, I would like to thank you everyone for joining this meeting. As usual, you will get the recording in a few days. Thank you very much again, and see you next week as usually. Bye, everyone.
Thank you. Thank you, Dr.